elbow products. I have the 74A Pop. It is a 5-degree adjustable post-op arm brace. When you apply this, you'll want to have the hinge to the outside of the elbow. So these are available in rights and lefts. This one has an optional supination and pronation attachment attached. When this is applied, you can tell your therapist that they will need to adjust the length of the supination and pronation attachment. And depending on whether they are achieving supination or pronation with this attachment, they'll need to kind of work with the adjustment on the brace itself. So we have 2 adjustment points on the brace and the length of the attachment. The 74A Pop, the Pop elbow brace, is available without that attachment as well. The next product is the Ratchet elbow brace. Ratchet elbow brace is our 84A Pop. And it is available in 16-inch length and 19-inch length. So we have small, medium, large, extra large in each length. It has the ratchet feature, so the therapist can adjust that ratchet. So we want to flip that knob out, and then as the patient goes into extension at 10 degrees, they will gain extension but not allow that arm back into flexion. This will continue to adjust out to full extension of the elbow. On the interior side of the arm, we're going to see a plastic supporting stay. So the hinge will fit to the lateral aspect of the arm, the outside of the elbow. And of course it does come with, because we are working at extension, gaining, and blocking flexion, it does come with a counterforce elbow pad. And that is the Ratchet arm brace. The next product that we have is the 88 UAB. The 88 UAB has been in the line for quite a while. It is a totally adjustable with infinite settings at 0 to 120 degrees. Does have inside set screws. So you'll use an Allen wrench to adjust this, and your therapist can get infinite settings, like I said, 0 to 120 degrees. So it's a great feature of this brace. It is a modular fitting brace. So this will completely break down for custom fitting. And the pads can be removed, can be applied to the arm, and then the hinge arms and straps are applied. The 88 UAB also has an optional wrist brace available, and the optional wrist brace will attach to the lower end or the distal end of this brace. So if you're using the wrist brace with this product, you'll remove the pad that comes with the 88 UAB and insert the pad of the wrist brace. So it will fit basically like that. The wrist brace has a nice elbow padding feature to it. So when you apply this to your 88 UAB, you'll have a nice area of extension in back of the elbow to protect the elbow. Also with the 88 UAB, we have the adjustments of the length of the stays as well. The next product is the basic arm brace. The basic arm brace has the same hinge as the universal arm brace that I was just demonstrating. It does have the same adjustments, 0 to 120 degrees, infinite adjustments. The difference on this brace is that the straps are fed through the side arms. The side arms are stationary, they are not adjustable, and it is orthoic material, where the 88 UAB is a breathable foam material. And that really covers the differences of those two products. So we call this one the basic arm brace. The range of motion elbow contracture orthosis. is made of a plastic material covered in an ortho-wick liner. It does cover the hinge completely when it is applied to the patient. So open the hinge and you can see the settings. The settings give a static stop at any point. Also, it comes with 2 set screws. The set screws can be used for flexion settings and or extension settings. It does come with an elbow pad for counter force and is used mostly for flexion contracture of the elbow. Also, the range of motion elbow brace has the pivoting distal end so that it stays flat on the skin. As the patient pulls into more flexion, the cuff will stay flat on the skin and allow that to not increase pressure over the soft tissue. So that is the range of motion elbow brace for elbow contractures. The next product is the Premier Elbow Brace. The Premier Elbow Brace is used for elbow contractures. It comes in the Codel material and also in the Ortho-Wick material. Those styles are both available. You adjust the T-screw, and it is a plastic frame that is available with this product, and you adjust the T-screw for static stop positioning. So every time you stop this product, it stays in static positioning. This does come with an elbow pad for your counter force as well, for your flexion blocking elbow contracture brace. The next product is the elbow stabilizer. The elbow stabilizer is the 48 ES. The elbow stabilizer is great for epicondylitis, elbow pain, stabilizing the elbow. It can be worn in several different fashions. In fact, your therapist or your doctor will really determine how your patient will best wear this product. This product has a pocketed Kydex stay, and the Kydex stay can be removed and heat molded. It can be worn as is as well, and it comes in several different lengths. We have this in a pediatric length, we have this in an adult length, and we also have it in an extended length, 15 inches. So this will basically just fit to the arm for the patient with elbow pain, epicondylitis, and problems of that nature with the elbow. The elbow sleeves. We have the 630 elbow sleeve. It is an elbow sleeve that just slides right onto the elbow, maintaining compression and warmth of the elbow. It does have the proximal and distal openings by Velcro closure, so it makes it very easy for the patient to don and doff. It does have a bicep strap as well, made of the breathable airprene material and has no latex. Fully supports the elbow when it is applied. The next product is the 650 elbow sleeve, and it has a free moving hinge. The hinges are pocketed on the inside of the product. This easily applies to the arm by pulling it on. We do have the proximal and distal openings by Velcro closure to make it easier for the patient to don and doff. This also has a bicep strap. It is latex free and airprene material. The next product is the hyperextension elbow sleeve, our 680 hyperextension elbow sleeve. This does feature the crisscross hyperextension straps, and it has an adjustable range of motion hinge. The hinge is adjustable at 10-degree increments. This one also has the proximal and distal openings for easier donning and doffing, and of course maintains warmth and compression for that hyperextension injury and any other injury that your therapist or doctor would deem that it be used for, and other conditions that are noted in the catalog. And that completes the line of the elbow sleeves. Soft contracture braces. The flex cuff brace is the one I'm showing you right now. This flex cuff brace is a contracture brace with a soft ortho liner. It is the hinge much like the ROM elbow brace, and this one has 0 to 120 degrees at 10-degree increments. This comes with a static stop pin that you can completely lock down at any point, at any given 10-degree increment. This also comes with 2 set screws, and the set screws can be used for flexion settings and or extension settings. Most of the time with this brace you'll work with flexion settings. The hinge is completely covered once it is on the patient, and this does not include an elbow pad. So if your therapist or doctor want that counterforce support, you would need to order an optional elbow pad for the flex cuff elbow brace. We also have the flex pop elbow brace. The flex pop elbow brace is a soft contracture brace like the flex cuff, only it has the pop hinge at 7.5-degree increments. The tennis elbow brace. The tennis elbow brace is great for patients with tendinitis or elbow pain or ulnar nerve pain or even cubital tunnel at times. It can be used to exert gentle pressure over the ulnar nerve area. So it's worn basically over that area to exert gentle pressure, alleviating pain of the elbow. It's the elbow brace.